Khurana Jewelry House, a legacy since 1950, has over the years come to be known as the epitome of exclusive jewelry designs and unmatched craftsmanship. Each jewelry piece at Khurana Jewelry House is a masterpiece with a promise of authenticity reflective of the brand's intrinsic philosophy and great heritage of trust. As North India's leading jeweler, Khuranas take great pride in offering an unparalleled retail experience where gold, jarao, kundan and diamond jewelry are available under one roof. Khurana Jewelry House has been adorned with over 30 national awards and is a pioneer in couture jewelry. With a vision to see Indian jewelry spread its wings to capture the beauty of not just women in India but also women overseas, Khurana Jewelry House has established itself as a recognizable brand at a global level by collaborating with Bollywood celebrities like Kareena Kapoor Khan, Janhvi Kapoor, Kajol, Madhuri Dixit, Dia Mirza, Aditi Rao Hydari and many more.
Dr. Avneet Grover, chest specialist, Medicaid Hospital, Amritsar. 2020 has been a difficult year for all of us because of COVID pandemic. And even in 2021, this pandemic is far from being over. In today's talk, I would like to break two myths related with COVID. People think that there is no treatment available for COVID, and second, they think they are immune to COVID. At Medicaid, in past 8 months, we have treated thousands of patients. So COVID is very much treatable, and no one is immune to COVID. In fact, here I want to highlight that it is treatable if it caught early. So please don't ignore the early symptoms related with COVID. Be watchful and go to your nearest doctor at the earliest if you have any signs or symptoms or doubt related to COVID. Stay healthy, stay safe.
Hello everyone, I'm Dr. Ruchika Grover, ENT surgeon and director at Medicaid Hospital, Amritsar. I wish you all a very happy new year 2021. 2020 has been a challenging year for all of us because of the ongoing COVID pandemic. Many undeserving lives have been lost and many more put at risk. It's a proud privilege for us that Medicaid has been able to serve the people of our city in times of need, and definitely will continue to do so. 2021 has dawned with new hopes for a receding pandemic with the coming of vaccine. But still, we must keep our guards on and practice our safety measures of social distancing, avoiding large gatherings, frequent hand washing, and keeping our masks on. I wish and pray that 2021 will be a much better year for all of us, and let's hope for a better tomorrow together. Thank you very much.
Hi everybody, I'm Dr. Pankaj Soni, critical care specialist, and my message to the community is very simple, that the timing of the detection, management and the treatment of COVID is very important. Why the timing is important? Because if you get symptoms say today and your symptom start deteriorating after 7 to 8 days, you definitely need medical attention, because after 7 to 8 days the cytokine storm, sepsis and the CT involvement starts coming. And the few drugs we can give, if we give those drugs as early as possible, the outcome of the patient is very good. So you should get yourself, very early go to the clinicians who are dealing with COVID. So the early detection and management of the COVID is the paramount important. Thank you.
FICCI Flow members, I'm sure all of you still want to know lots about COVID, and especially with the vaccines rolled out, you want to know too much about the vaccines. So get ready and join us today evening at 7 o'clock and have all your queries answered. Looking forward to having you all.
Good evening, Sat Sri Akal, and a very warm welcome to all of you to a much awaited talk, War on COVID, with our esteemed panel of doctors and Flow Amritsar. Welcome past presidents, GB members, all my fellow chapter chairs, their members, our friends and families, esteemed sponsors, and my very dear Amritsar members. On behalf of all of us here, I'd like to welcome our respected team of doctors who've taken time out of their very busy schedules for us today. Welcome Dr. Avneet Grover, Dr. Amrita Rana, and Dr. Pankaj Soni. Flow Amritsar thanks and salutes you all for your dedication and work as frontline COVID warriors. You all proved that service before self is not just a motto written in words, but is being practiced firsthand by brave hearts like yourselves. We all feared and closely watched the unknown devil as it lashed out to the world last year. The scare is yet not over. With around 11 million cases in India and almost 1.6 lakh deaths, this pandemic has definitely shaken up the whole world, where normal is not the way of life anymore. I'd like to thank Medicaid Hospital their team of doctors, nurses, and staff working with Dr. Ravneet Grover, their solid administration team with Dr. P.S. Grover and Mr. Sumit Arora for their management par excellence and providing top-notch healthcare in our city. A loud shout out to Dr. Ruchika Grover, ENT surgeon at Medicaid Hospital and my fellow flow member, who's been working extensively to get us all in this one frame. We at Flow applaud your constant and tireless service to our city and beyond, and would like to extend our gratitude to your families who supported you knowingly your lives were in constant danger. Thank you all for being here. May I request IT to please honor our guests with virtual trophies. Thank you. And now, without further ado, let's hear it from the experts. And for that, may I call upon our current secretary and incoming vice chair of Flow Amritsar and a very successful designer entrepreneur of our city, Himani Arora, to take this session forward. Over to you, Himani.
Thank you so much, Meeta. Good evening, everyone. I hope you all are doing fine. A very warm and hearty welcome to all our esteemed panelists and all viewers. Thank you for joining us today. The year was 2020. Ever since COVID hit mankind, the war is going on. And today, we are delighted to have amongst us our city's fearless, selfless COVID warriors. Before I introduce our eminent speakers, I would like to inform our viewers that this webinar is recorded and is being live streamed on YouTube. So you can forward the link after the webinar to anyone for future viewing. Now, I'd like to introduce our first panelist, Dr. Ravneet Singh Grover, Consultant and Head, Department of Pulmonary and Critical Care Medicine, Medicaid Hospital, Amritsar. MBBS alumni of prestigious Maulana Azad Medical College, New Delhi, and postgraduate from Vallabhbhai Patel Chest Institute, New Delhi. He's a fellow of National College of Chest Physicians. He has been a pioneer in various fields of pulmonology and respiratory critical care in Amritsar since 2008, like snoring and sleep apnea, allergies, interventions like bronchoscopy and thoracoscopy. He has worked immensely on COVID patients since the onset of this pandemic and has treated more than 2,000 patients in OPD as well as ICU. Dr. Ravneet, it's so good to have you here. Thank you so much for joining us. We'd love to hear from you. Our next panelist today is Dr. Amrita Rana, is practicing in the field of radiodiagnosis for the last 30 years, specializing in women's imaging and fetal medicine. She's held eminent positions in various doctor associations, including the Indian Medical Association and the Indian Radiological and Imaging Association. Recently received Award of Honor from Punjab IMA for rendering exemplary services during the COVID pandemic. Also, executive member of various women organizations, Fulkari and Flow Amritsar, rendering an active leadership role in cancer awareness programs and environmental protection. Dr. Rana, we are pleased to have you amongst us. Our next panelist today, Dr. Pankaj Soni, is MBBS from Grant Medical College, Mumbai, and MD from Tata Memorial Hospital. He's worked at various premier institutes like KEM, JJ, Escorts, Breach Candy, Mumbai. Having more than 20 years of experience in critical care, he is presently working as Chief Intensivist and Critical Care Specialist at EMC Hospital. Being the President of Indian Society of Critical Care Medicine, he has more than 100 presentations at local, national, and international platforms. During COVID pandemic, he has treated around 900 COVID patients. Dr. Soni, thank you so much for being here with us today. And now it's time for me to introduce our dynamic day chair of the event, Dr. Ruchika Grover. MBBS from GMC Amritsar, DMB from Jaipur Golden Hospital, New Delhi. Presently, she is practicing ENT surgeon and executive director at Medicaid Hospital and Critical Care Center, Amritsar. She's practicing in Amritsar since 2008. trained at Max Smart Delhi for advanced ENT surgeries and Singapore for snoring and sleep apnea surgery. She's doing all basic and advanced ENT work with special interests in deafness, vertigo, and snoring. Over to you, Dr. Ruchika.
Thank you, Himani, for such a lucid introduction. Thank you, Meeta Mehra and Fiki Flo, for the opportunity of hosting our esteemed panelists. COVID has literally taken away the year 2020 from us. Many of us here today have gone through the harrowing experience of COVID disease, its physical as well as mental impact. Though a lot has been said, heard, and done about this deadly disease in the last 10 months, but there are still many debates and controversies around it. So today we would like to hear it all from the horse's mouth, and that is our panelists. Thank you, panelists. And as Himani has already welcomed our worthy doctors, Dr. Avneet Grover, Dr. Pankaj, and Dr. Amrita Rana, I would straight away start with our panel of questions. So my first question would be to Dr. Grover. So we are all aware of the symptoms of COVID, including fever, cold, loss of smell and taste, and breathlessness. So how does COVID affect a patient's lungs?
Yeah, at the outset, I would first like to thank Vicky Flo for this wonderful platform and to Himani for a very nice and lucid introduction. COVID is a unique disease. We have seen so many viral diseases and viral pneumonias, as Dr. Pankaj Soni will agree to it. Normally, viral pneumonia simply causes pneumonia, which causes a parenchymal type of infection. But COVID tends to destroy the lungs. So, what COVID does? COVID is a two types of reactions happen in the body. One is the infective process, that is a virus enters into the body and it causes a respiratory epithelial infection. And more deadly than that, it is a unique propensity to cause hypersensitivity or allergic immune response in the body, and that becomes lethal for the patient. So, if we consider from the scientific point of view, one is a viremia that happens in the body. The virus enters from the nose, it affects the respiratory epithelial lining, it goes into the lungs, it destroys the alveolar epithelial lining. So, the patient starts having the respiratory symptoms in the form of cough, difficulty to breathe. More than that, as I'm talking about the allergic hyperimmune response, in that what happens, it generates cytokine storm of a thing, where there are so many cytokines or immunoglobulins that come into play into the body that causes a lot of destruction, so that it doesn't remain any longer a respiratory disease, it becomes a multisystemic disease. And that cytokine storm destroys the respiratory epithelial lining. It causes what we call the non-cardiogenic pulmonary edema, which fills a fluid in the lungs or in the alveoli. And moreover, it is also known to cause a thrombosis of the blood vessels in the lungs. So all the three mechanisms of transferring the oxygen from the air into the bloodstream are lost. Namely, the respiratory epithelial lining is destroyed, our lungs get filled with fluid, and the vessels will transfer the blood. They are all occluded. So I think it's one of the most deadly respiratory pathologies that we have seen in due course of time.
Okay. So, Dr. Pankaj, I would now like to ask you that we have heard a lot about patients with diabetes and heart diseases are more at risk of COVID than others. Is there any truth in this?
Yeah, good evening, everybody. First of all, I am privileged to be the part of the this seminar. Now, straight away to your question, Dr. Ruchika, about the patients who are having diabetes and hypertension. Definitely, the comorbid conditions are playing a very important role in the severity of the disease. We should understand that the patients who are having diabetes, they are already having a very bad immune response and a hyper-inflammatory response in the body. So it is like there is a very good study in the like Italy, where they found that the severity of the disease increases with the patients who are having diabetes, who are having hypertension, who are having cancer and who are having chronic other diseases. So the diabetes is one of the very important uh, uh, disease, because the mortality increase by 30 to 40% in the patients who are diabetic. So it is a indicator of mortality. A very good study also came that the 99% of the mortality is with these 4 5 comorbid conditions, and the hypertension and the diabetes with obesity, which is called metabolic syndrome, leading to the mortality of 76% of the patients. So yes, the hypertension and the diabetic, specifically the diabetes which is uncontrolled. So the controlled diabetes is definitely, they are having lesser severe disease as compared to uncontrolled diabetes. So yes, those patients who are having comorbid conditions, they are at much higher risk for severe diseases.
Okay, thank you, Dr. Pankaj. Dr. Amrita, ma'am, I would like to ask that once the patient has developed some signs and symptoms of COVID, when is the time to get an X-ray or a CT done? And which out of these is the preferred modality?
Hello, Ruchika, and thank you, Flo, for giving me this opportunity. And congratulations, Meeta, you're always taking up the hot topics, the important ones, and keeping all the members abreast of the latest developments and happenings.
Thank you, Dr. Rana. Thank you.
So, Ruchika, to answer your question, see, the clinician is always there once, now that we know, and Dr. Grover has already highlighted the symptoms. So, once the patient is having cough, fever, breathlessness. So, as per the affordability, one must go either for an X ray chest or a CT scan. CT scan is definitely the better modality, it's the modality of choice. But X ray chest also has a particular pattern for COVID infections, so also helps in diagnosis. So with all the symptoms happening, myalgias, fever, and breathlessness, one should go for at least straight away an X-ray chest and CT as per indication. Yes, Dr. Ruchika?
Yes, ma'am. I think part of your thing was there was some internet problem. Okay, let me come back to Dr. Ravneet with my next question. So, there are a battery of tests which can be done, which have been suggested by a lot of doctors, by in the news, in studies. So, like CBC, the CRPs, LDH, D dimer, and the patients actually go left, right, and center getting all the tests done. We don't actually know how much is the value of which test, because of course everything comes at a cost, and with covid times, people are not working and all, cost is definitely an issue. So I would like you to please guide us that what are the tests that should be done for the detection of COVID and as a marker for COVID.
Yeah, Dr. Chika, having managed thousands of patients by now, I think when once a patient walks into your OPD with a particular symptoms of a fever, cough, breathlessness, and the patient is diabetic, probably you don't need any test to diagnose that patient. But yes, if we are having a clinical suspicion, we have to follow a certain protocol, and for that, if the first test is always a PCR test. Now, PCR also has been a very controversial test because the public doesn't understand that it has a sensitivity of only 70%. In 30% of the cases, the patient might be having the disease, still the COVID PCR may be negative. So I normally go in for the CT scan test where I have a high suspicion of COVID disease, but the PCR report is negative. And as Dr. Amrita mentioned, there the CT really comes to our help, that we are able to diagnose a subtle disease which we are not able to diagnose on X-ray or on PCR. CT really helps in diagnosis those cases also. And coming to the blood investigations, Dr. Pankaj will agree with me if the most important investigations are CBC and CRP, because they correlate very well with the disease severity and they respond very well to the treatment. Other markers which have become fancy markers, I would say they include LDH, they include D-dimer, they include IL-6, but these are basically all the markers of inflammation, like is CRP. CRP is also C-reactive protein. It is also a marker of inflammation. So either we can get all these tests done if we want to, as a see what is the degree of inflammation at the start of the treatment, and then we can repeat these tests either. I would say any one of them, with whichever you rely more upon. I've seen some doctors rely more upon D-dimer, other relies on IL-6 or but these are all costly tests. In my practice, I have relied mostly upon CRP, and I have found it is a wonderful marker of inflammation and correlates very well with the disease response.
Okay. So Dr. Pankaj, would you like to add or, your comments about this?
Yeah, this is very nicely Dr. Ravneet conveyed like what all tests we have. We have a multiple battery of tests. Specifically, people get all these tests before coming to us. It is very strange. Like they already had done. CRP is already done. LDH is done. D-dimer is done. IL-6 levels even done. So what I feel that your basic CBC is very, very important. Apart from the CRP, the interpretation of the CBC in these type of cases is very, very important for a good clinician to make out that whether your patient is going into sepsis or he is having a component of cytokine storm. The NLR ratio, which is very, very important ratio in these type of cases. So probably I agree with Dr. Ravneet that we should not go with fancy testing, because we do IL-6 testing and all, and then they arise and people talk about कि sir वो बड़े वाला injection लगा दो. So there are a lot of problems, because there is a lot of literature floated into the market. Like you will be surprised that 1.5 lakh paper got published, and all papers have free access during COVID. So the huge substandard articles got circulated, and they cause more harm than the benefit. The authenticity of PCR, very nicely said by Dr. Ramneet. I totally agree with him about the CT scan. Is a very, very reliable test. But for to label a patient as COVID positive, we need to have a RT-PCR positive. We are having the patients who are having, correct score of 21/25 or 80 to 90% lung involved on CT, and RT-PCR still negative. So these are the practical problems we are having. But yes, these tests like the basic CBC and CRP should be done.
Okay. And what has your experience been like dealing with COVID firsthand, in ICUs, pertaining to the clinical impact and the psychological impact on the patients?
As Meena madam rightly said, and you also emphasized on that 2020 is a difficult year for all of us. And with the COVID is at such a high note, like in the last year, that
I think we lost Dr. Soni's connection because he's at pause.
Yeah, I can't hear him.
Shall we move forward? Wait
Yeah,
for
I think we can move on.
he can join in once we see.
And he
Screen is
can
paused.
join again. Okay. So Dr. Amrita, my next question would be to you. Like as we all agree that CT scan is the preferred modality of radiology that should be done. So there are a lot of scoring systems that are being given. One of them is like the CORAD score, which is being used. So what is the significance of this CORAD score? Is it linked to the severity or the type of disease, and does it have any impact on the treatment of the patient?
See, CORADS is it's a, you can say, a small word for COVID-19 reporting and data system. So basically, so that we have a uniform reporting system, this was developed, and this helps to detect sometimes COVID positive patients even when RT-PCR is negative. So the score goes from 0 to 6. So 0 is that it is not interpretable. 1 is normal or non-infectious. So 2 would be low indication for COVID. 3 again is a kind of indeterminate. 4 is high. 5 is very high. 6 is proven with PCR. So this is how the CORAD score is. There is another thing called severity index. So there are two methods, but we in India are following with 1 to 25 score. That scoring is, we have lobes in the two lungs. So how much of each lobe is affected? So the score is assigned as per the infection, the lobe, the part of the lobe involved. So the score which is less than 8 would say mild. 9 to 15 would be moderate, and more than 16 and above would be severe. So this, see, actually everybody would be reporting on the same pattern. So
Right.
it's easier to follow and it's easier to monitor. So that's how the correct scoring and severity index is done.
Okay, right. Dr. Pankaj, would you like to continue with what you were saying
Yeah,
earlier?
sorry, my connection got lost. You know, in ICU for the last 6-8 months, we are dealing lot of COVID patients who are RT-PCR positive, and few patients who are even RT-PCR negative are having very severe disease. The first thing is you were asking me about panic. Definitely, in the early phase, in the like May, June, July, there was a huge fear psychosis and panic in the public, and even like we people were not aware because it was a new disease for us also. The
Right.
working in the kits and the working for, like, it was not, we were never trained to wear a PPE kit and work. That was the biggest challenge for us. The more bigger challenge was to motivate the staff, the motivate the our team. This was very, very difficult times where we need to have a motivational lecture also, that okay, this is the time we have to carry on and we have to work. And after doing all this, like, we could able to save lots of lives, and that was the only uh, happy thing we can say, that being a doctor we are very happy when a patient on ventilator, we extubate, and that is the time when we have a smile on our face.
Happy moment for
So
doctors.
yeah, so for all of us who are working in critical care, pulmonology, so this was a very, very difficult time. And the problem was, there was lot of literature. The guidelines were changing day by day. Every 10 days ICMR was coming with a new guideline, and the new treatment modalities, few new drugs, those drugs those were expensive drugs.
And
So
nothing
like
was
those,
proven also.
pardon.
Nothing was proven also.
Yeah, that was the biggest challenge, except the remdesivir, which had a lot of controversy around. No other drug was proved by FDA. All other drugs were proved on the emergency basis. So so
Right.
so even these vaccines, when we talk about, they are approved on emergency basis. So the drugs which were proved by FDI and other authorities, there were lot of literature bombarded. So that bombardment, in between that bombardment, we had to work with the PP kits, and people were also not, educated enough, and we were also not educated enough, to be very frank, in the May June, what to do. So it was a very difficult time, and so like I still believe that India did fantastic job. The reasons we will discuss, in the course of uh, 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 the CME. But the most important thing was, like, we need to have a teamwork. We need to motivate the people around you, your juniors, your consultants. Everybody need to be motivated to work. Now the things got settled. Everybody is, aware of how to handle the
Comfortable with it
COVID.
now.
Yeah.
Right. Dr. Ravneet, would you like to add any of your experiences to as an OPD, as a hospital administrator, as an ICU person? Would you like to add on to your experience?
I would just like to say we have never seen so much difficult times from all the angles. The time was difficult for the patient because we had to keep the patient in isolation, and patients were not used to stay away from the families. It was like yes, up you deposit the luggage at the railway station. So the patient had to really deposit their family members to the hospital. We had deposited the patient to you, and they never knew whether they are going to see that patient again ever or not. And even the patients, you're talking about the psyche of the patients also, over a period of time, initially they used to have a good frame of mind, but over a period of days they used to get psychologically totally nervous breakdown would happen. And we have to manage not only the disease, we have to manage the psychological part of the
Right.
family, of the patient, of the staff. The staff is so much fearful going close to the patient, and even your own psyche, because you have one thing in your mind. Okay, you are going ahead, you are treating the patient, you have the duty and your responsibility at the fore, but then there also comes the responsibility and the safety of your own family, of your own kids. So I think, and at least in my experience of past 15 years, we have never seen so much difficult times, and we are lucky that all of us who have fought COVID are sitting here and talking alive.
Yeah, that was a good one. Okay. And so let's come back to the clinical part. Is there any predictive factor to know how mild, moderate, or severe the disease would be in any patient,
Yeah,
or in any way it modified? Whether the one who's going to have a severe disease would have a moderate or a mild form. If we can know beforehand, would that be possible?
yeah. When I was a child in my school, my father taught me a quotation. The quotation said, "The more you know how little you know." I think this quotation holds absolutely correct for this COVID. I would say this disease is totally unpredictable. Nobody can predict. Sometimes we have saved patients who are above the age of 90 years, and we have lost patients who are below the age of 40 years. So my what I've seen that there is definitely a genetic component to it. Yes, there are high risk factors, the cardiac factors, the immunocompromised status, the diabetic status, but they are not absolute. We have seen patients who are totally uncontrolled diabetes. They responded in a few days, going back home hale and hearty, and non-diabetic young persons coming to the disease and never going home and never coming out of the ventilator. So, Dr. Pankaj probably will second this. There are research is definitely going on, and some papers have got published that there are genetic predisposing factors. There are genetic makeup or immune system of the person, how it responds to this COVID antigen that enters into the body. So some people just don't need any treatment. Simple vitamin C and zinc, they are all hale and hearty. And some patient, whatever you might try steroids, remdesivir, and other fancy tocilizumab like drugs, and nothing works in them. So the science really has to still work on it, and I feel there are more of a genetic factors, and but genetic factor is not something which is in our hands. What is in our hands till date, if we are talking about this COVID pandemic, we're talking because it's not yet over. Please, to the audience, my clear message is, please don't take it as if the pandemic is over and we have won over the pandemic. Still there's a lot to be done. At the rate that there was a prediction that at the rate at what the vaccination is being done, it may take over a decade for the whole population to get vaccinated. So it is still very much there. So what is in our hand is, if we are able to treat this disease early. So my word will be, please catch the symptoms early. If at the start of the fever, at the minimal lung involvement, at the only URI, if you are able to diagnose the disease and treat it, you don't even need hospitalization to treat the disease. But where we lose time, where the already cytokine storm or lung destruction has happened, then I don't think there is still any drug that can save that patient.
Right.
That's my take.
Hmm. So, and
Uh,
Pankaj, yeah, you were saying something?
See, very nicely said by Dr. Ravneet. I just want to add the same thing in a different way. The timing is very, very important in all this. When you come to us in a condition where your 90% lung is already involved, and the saturation is around 52%, it's very difficult to save those type of patients, even if they are younger age group. So the happy hypoxia concept was there. You know what happened? It's a different type of hypoxia. Whenever we have a little fall in saturation in our body, the body start giving symptoms. But because of the pathophysiology of COVID, the hypoxia which occurs in COVID patients, they tolerate that hypoxia and they stay at home till the breathlessness came into the picture. So that is the issue. So the everybody who is having fever or cough or all these type of symptoms, they should monitor their SpO2. That is very, very important. Oxymetry is very important. I believe that if the only one test, if I have to see in my patient, I will see that how much is your oxygen in the room air. If his or her oxygen is above 94, 93%, I will say that, okay, like it's a better prognosis. If the oxygen saturation is less than 93%, the prognosis definitely goes very bad. About the genetic correlation, we need to know a lot of things about COVID. This is one of the things, but definitely the comorbid conditions like diabetic, hypertension, CAD, cancer, immunocompromised patients, they do have much higher mortality as compared to the younger age group.
Right.
And it is not affecting, I just want to add last point, very important, that it is not affecting and giving very severe symptom in the age less than 12 years or like the younger age group, around 12 to lesser age group. I yet to see a full-blown COVID in a patient who is less than 10 to 12 years. That is good. The
That
God
means
is kind to
schools can safely
mankind, I
open up.
believe.
So that means the schools can safely open up for the kids. I think we've lost Dr. Pankaj again.
Yeah.
Okay, so Dr. Amrita, I would like to ask you, once we get a CT scan done, what other diseases, can look like COVID, and we can have a confusion like, what is COVID and it is a non-COVID disease.
So basically, COVID is a viral pneumonia. So other viral pneumonias also will look like COVID, and there is something called cryptogenic organizing pneumonia, which is a close differential diagnosis of COVID. But
Okay.
somehow in all these, because the whole world was focusing on this, so certain patterns specific for COVID-19 have also been found out on CT chest. So when those are present, then the detection rate is very, very high.
Okay, right.
So,
Thank
so even like we know in the earlier stages, there were lots of There was a lot of confusion. The government also would, every government wanted that we should have less number of cases. So the cases which were positive only on CT and not on PCR, they were questioned. But later on, all from the data collected, it was found that, and also Dr. Grover has already told that RT-PCR can be falsely negative, but
Right.
CT has had a very, very high detection rate because of particular pattern of involvement of lungs.
Okay.
So,
Right.
but all these symptoms and putting everything together, you can get a right diagnosis. When you
Okay.
combine the symptoms, the CT diagnosis, the blood parameters, the
Okay, right, ma'am. So, okay, so now having discussed about, how COVID happens, what is the pathophysiology that happens, what are the clinical features, how the patients respond to it. So, I think coming to the vaccine part, which is the probably the hottest and the most important and the most talked about, topic of today. What vaccine, which vaccine, whether to get it or not. Let's just get with that. So, Dr. Amrita, ma'am, would you please like to tell us, what are the kinds of vaccines that are available for COVID now, as of today? Ma'am, please unmute yourself.
if we talk of vaccines, so there are four types of vaccines. One would be a whole virus vaccine, means the virus itself is given. So that can be in two forms. One is live attenuated, second is inactivated or killed virus. So live attenuated is something like measles, like in polio. The oral polio drops also have this kind of methodology used.
Right.
In India, we have two vaccines. Covaxin. Covaxin is the inactivated or the killed virus. So the second is we use a protein subunit of the virus. Third is we use nucleic acid. Nucleic acid would be either RNA or DNA. So the mRNA is that Pfizer and the Moderna, which are being used in West. So another is viral vectors. So that is what we are getting is Covishield in India. So in India, we have two types of vaccines: the inactivated killed virus as Covaxin, which was developed by biotech, and Covishield, that is Oxford AstraZeneca, developed by Serum Institute Pune.
Okay.
So these are the two vaccines which are available in India. So in Punjab, so far, Covishield had come, which has been taken by many, including myself. So
Right.
now we've come to know that the Covaxin has also come in Punjab.
Right. Thank you. Dr. Ravneet, I would like you to elaborate on, what would be a preferred vaccine? Would it be Covishield or would it be Covaxin? And either of them, are they like safe for our people to take? And are they actually effective? And how much is the efficacy of these vaccines?
Yeah, in the history of medicine, we have never seen so many myths around anything like what has happened among COVID. So anything that comes in COVID, that becomes a controversy. So the reason of that controversy is because, as Dr. Pankaj said, there is access to everything to the public. Initially, the paper that used to get published in the journals, paper doesn't mean that it is the final analysis or final conclusion. They are the research papers, and after thousands of research paper, there was a single conclusion that used to happen. Now that every new paper or study comes into the market, that gets on the WhatsApp, on the web, on the Facebook, and the public getting confused as if the scientists or the doctors know nothing about it. So one myth I would like to break is that people say that we are being used as guinea pigs and the government is trying the vaccines on us. That is totally false. There are phases of vaccine trials. Phase one is where they use only on the mice or on the animals. Phase two is where they use it on the volunteers. And phase three is where they use it on the large population base. So all these vaccines have cleared at least phase 2. Yes, we would have loved that the vaccines have cleared the phase 3 before they were being given to the public, but that time we would have lost so many lives. So in all the phase 1, phase 2 trials, the vaccines have been found to be very safe without any major side effects. If you talk about zero point 0.1 or 0.2% side effects, every vaccine has that much side effects, and that is something which has to be accepted, because we always have to see the risk benefit ratio. So my point is that the benefit of any vaccine which is available far outweighs the risk associated with it. So whatever you get, whichever vaccine is available, the Covishield test that has cleared the phase 3 trials also, and for Covaxin the phase 3 trials are already going on, and it's been launched in India for almost from past 1 month, and nobody has seen any major side effects associated with it. But as of now, if we talk about which vaccine, we actually don't have the option. Like Dr. Rana mentioned, in Punjab, we only had Covishield as of now. So if it was there, we had to get it. And for the general public, I don't think it's before next 2 or 3 months the vaccines are going to be launched in the public market. So whenever they are being launched, I feel we will have more input, more research on that, and will be in a better position to choose upon a vaccine which is better and which is worse. But as of now, whichever vaccines are available in the market, they are there after adequate research. They are safe and they have adequate efficacy ranging between 70% to 90%. But yes, the fear of not taking a vaccine should not hold you from taking the vaccine. Just go for it. You must go for it, because we don't still have herd immunity in our country.
Okay. My last question for the evening. Know from you in which age groups the vaccine can be given, and after how long of the vaccine can be considered that a person is protected from the disease.
Uh, See, the point is one or two things I just want to add about Covishield and Covaxin. First is Covishield. When we talk about Covishield, in that the phase 2 trial, the efficacy was around 90%. And the phase 3 trial efficacy came to 70%. So the people start questioning that if the efficacy is 70%, then why should we get vaccinated? Because it's 70%. But the very interesting point is those who got vaccinated, they never had a severe disease. The 70% got totally immune to the disease as per the third phase trial, and the rest of the patients who even had disease, they never had the severe disease. The second point is like, I got one question very interesting from somebody, like, is that vaccine is effective against the newer strains? So the Covishield, which is by the Pfizer and AstraZeneca, is effective against UK strain, but unfortunately, the African strain, Africa discontinued using Pfizer and AstraZeneca vaccine, Covishield, recently, because it is not effective against African variant. So two variants so far we got. Definitely in India, we may be having a lot of variants. We don't know. We are not doing any gene analysis. So I feel that these are the two important points. Apart from the age, all patients who are less than 16 years of age and pregnant females and the lactating females are excluded from all the studies. And in the so probably the age group between 15 to 65, they included the only those patients or those volunteers, and they find this efficacy. There is a concern in the Italy because there the population is very higher age group. So like above the 65 there is no literature as such, but they are saying that okay, it will decrease the severity of disease. So everybody who is uh, between the age group of 15 to 75 should get vaccinated.
Okay. And I would say this is an open question. If you have already suffered, if a person has already suffered from COVID, is there a need to get need for them to get vaccinated as well, or they can go without it? We consider them immune.
According to ICMR guidelines, like they said, like after 19 days of COVID negative, you should get vaccinated. This was from the ICMR guidelines. But the recent studies which came, they say that you should get vaccinated as soon as you become negative. The recent literature is favoring that. So probably we are also, every day the literature, the good literature is very important here. So like I was infected with COVID, and I got vaccinated within 2 months. So the same was about my wife, Dr. Sonali. So we got vaccinated within 2 months. So the point is very simple. We should vaccinate it according to ICMR guidelines, 90 days, because the antibodies stay according to them 90 days. But you should get vaccinated whenever the things are available for you. You should get vaccinated.
Okay. So do we need to get an antibody test done before getting vaccinated, or it's not required? Dr. Ramneet,
No,
would you
no,
like to
no.
answer that?
Yeah, I would like to
Yeah,
add
please.
to it. The question is, why should we get vaccinated once we have already developed antibodies or have we gone through the disease? The reason for that is because over a period of time, the antibodies tend to, so they are no longer protected. There is a possibility that you might get reinfected. So if you have already got the COVID infection, if you get yourself vaccinated, this vaccine will act as a booster to enhance your immunity further. These vaccines are not that the antibodies are going to last forever. Maybe it is predicted that the antibodies, even with the vaccine, may last somewhere between 1 year or 2 years. Even after you have the COVID, the antibodies over a period of time tend to decrease. So that's why even the people who have got COVID, they must get themselves vaccinated.
I would like to enforce here that, in fact, if you've already got the infection and the antibody levels are there, in any case, we're going to get a second dose after 4 weeks. So, 4 weeks after you've got the infection, if you take the vaccine shot now, it's like a booster dose. So, you will get a third dose on the second dose, in fact, actually. So, that will build your immunity better. Only thing is that you should not take the vaccine once you're having an active COVID infection.
Right.
Then you are not supposed to take it. 4 to 8 weeks, 4 to 8 weeks after that, you should take it.
Okay. So with this, I would like to conclude our panel discussion. And thank you, panelists. It was a great discussion, and I hope all our audiences have benefited greatly from this talk. I would now like to hand over to Dr. Sonali, who's a fellow FLOW member and a radiologist, and she would be taking the question and answer session from the audience.
Uh, Good evening, my doctor friends. Am I audible?
Yes, yes, you're audible.
Good evening, my doctor friends, experts. Good evening, Meeta, and all the members of Executive Committee of FLOW. Myself, Dr. Sonali. I am radiologist at Navya Diagnostic Center, and I will be taking the question and answer session. Mostly, the lot of queries are being answered in the panel discussion only, but we will need some finer details also. So, while we mostly hear about Covishield and Covaxin, these are different types of corona vaccines in various stages of development. Can you please explain the difference between these different types of vaccine being developed in terms of their toxicity, side effects, and efficacy? This is questioned by Mr. Sanbir Singh Wadhwa, and his question is for Dr. Pankaj Soni.
Sorry to interrupt, but if Mr. Sanbir is here live, can we focus the spotlight on him?
Yeah,
He
sure.
can directly ask the question. Would that be? Can we work that out?
Sanbir, are you there?
I Guess not. If
I guess not.
okay, then Dr. Sonali, whatever names you have, if you can just ask them personally, we can give them the spotlight and they can directly ask the doctors.
Yeah.
Thank you. Thank you.
I think pretending to your question, already Dr. Rana, madam, already conveyed very nicely. But still, like we are having two vaccines. One is Covishield, which is by the Pfizer and AstraZeneca. So that vaccine is basically spike protein vaccine. So this goes into the body and uh, create a immunogenic response and create the antibodies. And the second vaccine, which is Covaxin, which is a indigenous vaccine of made by India only, with the ICMR and National Institute of Virology. So that vaccine is had completed phase 2 trial. So the vaccine that vaccine contain inactive virus. So uh, the normal. There are two type of side effects of vaccine. One is milder side effects and one is severe. So I don't want to talk about much about side effects, but remember, like even when we are traveling in a on a high speed car and we are having four balloons in our car with seat belts on, if we had accident, we still can have minor injuries. So same is true about these vaccines. So these vaccines will provide us the good immunity and the severity of disease will go down drastically. The most common side effect is fever and body ache. The fever and body ache is reported in about 10% of the cases. The other severe side effects are in a very 0.101 percentage type of the severe side effects. But these are even with the paracetamol can cause liver dysfunction. We should not worry about these side effects and we should go ahead with the vaccination.
And what about the efficacy comparison between the two? They are equally efficient
See,
or?
uh, efficacy, I already told that Covishield is having, according to the phase 2 trial, it was said that 90 to 95% efficacy. But with phase 3 trial, it turned out to be exactly 70.6% efficacy in the Covishield. So Covaxin is still in the phase 3 trial, and according to phase 2 trial, it is again saying that they are saying 90% efficacy. But the point here important is that if even the efficacy is 70% or 75%, the severity of diseases definitely is decreasing with the vaccination.
Okay, thank you very much for the expert opinion. The second question is for Dr. Ramneet. It is by Mrs. Meeta Mehra, our flow president. Would she like to go ahead with the question, or I would?
Yes, thank you. Thank you, Dr. Sonali. Hi, Dr. Ravneet. Thank you so much for being with us. My question is for you that now that we are approaching spring, which is also known as major allergy season, we asthmatics, I'm a big asthmatic, allergic asthmatic, anyway, go through a lot, like a tough time during the change of season. How can we differentiate between viral infections, allergies, or asthma symptoms from typical COVID symptoms? How can we differentiate? And what would you suggest to chronic allergic patients like myself to be more vigilant of, and any change in regular care and any extra precautions to be taken? And after you answer this, I have another one for Dr. Amrita Rana.
Yeah.
Thank you.
I would appreciate Mitaji for bringing out such a relevant question. I think it is very relevant for the general public. May not be scientifically, but for general public, because even if you sneeze once, it's okay. If you tend to sneeze twice, you get crazy. Oh, I'm going to get COVID or Corona. So, how you differentiate between the virus? This COVID is an infective disease,
Right.
and the other what we talk about asthma, they are the allergic disorders.
The primary difference between the allergic and the infective disease is a fever. Normally, if you get allergic symptoms, you get sneezing, you get cold, you get your breathlessness, cough, which is related with asthma. Most of the times, you won't get fever.
Right.
But in this viral disease, fever is a primary symptom. So I think if you are just having this simple cold, cough, sneezing, and there is no fever, there is no significant body malaise, there is no significant headache, there are no body aches. So I think it can be taken as simple allergic disease. You can take your regular anti-allergies. If you use inhalers, you can use your inhalers. But if you start getting fever along with that, that something should not be ignored, and you should go to your doctor immediately if you have any symptoms related with fever, body aches, headache, vomitings, or which cannot be explained by simple allergy. Even if you are having the allergic symptoms and you are taking anti-allergics, if your symptoms don't respond in 4 to 5 days, again, please don't be your doctor. You must consult a specialist so that, as we mentioned time and again during this session, that in this early diagnosis is the most important factor. If you miss the diagnosis by doing the home remedies, but then I think nothing is going to come to your rescue. So even if the slightest of the doubt, there are so many specialists available in the city. Even if you are not getting an appointment of a super specialist, you can simply go to a physician to at least clarify your doubts. And one wrong notion that is spread is, even if you get the sneeze, go in for a CT scan. I
Yeah.
think Dr. Amrita said that is again very wrong. You are putting yourself at the exposure of radiation exposure unnecessarily. The kids, the ladies, everybody's getting the radiation exposure. You don't need CT scan for all symptoms. Let the doctor decide where only X-ray is good enough, where just a clinical examination is good enough, and where you need the CT scan.
Right. Thank you. So the best remedy would be to not waste any time. And if I think a person themselves can tell that something is not right, and if that happens, one should not just sit around and wait for symptoms to increase and just go see a physician. Thank you. That was really helpful. And Dr. Amrita, I have a related query, for you. Would you suggest any regular scanning or tests for chronic patients like myself suffering from allergic asthma, especially during these unprecedented times, to avoid any sudden complications? Like I've known of people also suddenly, like within 24 to 48 hours, their condition worsens. So, do you recommend any testing or scanning at a certain period of time if one feels any symptoms?
I would not say, again, Dr. Grover just now said, don't jump and go for CT scan or anything like that. It's really not needed. And let your physician decide that. Let your physician decide that. A person who's having allergies for the last so many years, you can identify your symptom very well. So, and also you do get to know that it's not improving with my regular medication or it is worsening. And if there is an added fever or something like that, then of course, earliest, simplest you can get it done is an X-ray chest. That also with the advice of a physician. So a few blood tests may be required, but again, with the advice of a physician. We should not try to self-diagnose and treat. It's not
right, because no matter what you say, paranoia has set in general public. So even if we know that we're dependent on certain medications, it's actually a mind game. You have to calm yourself down and tell yourself that no.
I have seen Meeta in this COVID time. She's been very, very responsible also. Little flu symptom, she would isolate any of her family member, any of her staff members, get them tested, RT-PCR on the 5th day. She would ask, usko ye symptom hai, kab test karana hai, kab karna hai. You've been socially very responsible, but paranoia has to go up.
Thank you. Yeah, we have been mindful about it. Thank you. Thank you so much, Dr. Ravneet and Dr. Rana and Dr. Soni. And Dr. Sonali, I think we can move on to the next.
Yeah, crux of the story is not to ignore any major symptoms.
Right.
And consult a physician as early as possible. So the third question is to Dr. Mrs. Amrita Rana. It's from Sinu Arora, Vice President. He is President of Vice of Amritsar, ex-President. Is he here? Sinu, are you there? So I would like to narrate his question on his behalf. It has been nearly 2 weeks now that the health workers started having the vaccine. What are the feedbacks on having any adverse reactions been reported so far? And second is, how long the immunity will last once a person takes 2 doses of vaccine? Dr. Amrita.
Only minor side effects have been reported. As Dr. Pankaj also said, just a little fever or a little body aches or cough, a little minor flu-like symptoms, and which usually go away within a day or two, or a simple paracetamol tablet. And no major side effect has been reported. There was a case which in the papers that a doctor died because of cardiac.
Sinu is there? I think.
Yeah.
Hi.
Hi.
The question I just asked on your behalf.
I had heard it.
Continue, Dr. Amrita.
That was also on autopsy. It turned out to be a cardiac issue itself, nothing related to vaccine. And as regards how long the effect will last, that we will have to wait and watch. But so far,
anything from the COVID experts about how long the effect will last after the 2 doses of vaccine are being taken?
It is not only about COVID, it is true for all the influenza vaccines.
Yeah.
So the immunity normally lasts for 1 to 2 years for all the influenza vaccines. And it is not only the immunity that wanes off. Actually, over a period of time, these viruses have a tendency to mutate. The strain changes. So once the strain changes, the immunity that you have got from the vaccination is not going to last. And moreover, we don't need a lifelong protection. It is a pandemic. Even the pandemic is going to go away another year or so. So what matters is we have to protect ourselves for the coming year or so, and the vaccination will do its job.
Okay.
Thank you.
That's all. The question 4 is from Mr. Ranbir Singh, who is 70 years old and wants to ask, this is for Dr. Ramneet. Is it safe for me to get a vaccine as I'm having underlying disease such as fibrosis of lung? And a similar question was also asked by Kritida Sachdeva. She said a patient is having renal disease and any other underlying condition. By Mr. Baltaj Singh also is asking same. If a person is having any underlying medical condition, is it safe to get yourself a vaccine?
I think Mr. Ranbir Singh is with us. And
hello.
Satrikal ji.
Satrikal ji. Tanu, which medical issue are you suffering from actually?
Fibrosis lungs.
Fibrosis of lung. Question to Dr. Ramneet.
Yeah. Actually, it is more important for the patients who have underlying disease to get themselves vaccinated because they are more prone to the disease. So as per the Government of India regulations, the vaccine is not approved for people or children less than 18 years of age because no trials have been done, but there is no upper limit of age. So it can be given to any age group and it can be given to any person who has any underlying comorbidity. The only contraindications that has been discussed before is if the patient has disease or if the patient is pregnant. They are the main primary contraindications for getting the vaccination. Otherwise, all other comorbidities are no contraindication. In fact, it is more important to get yourself vaccinated because what we are giving is not the virus that is going to affect you. What we're giving, either it is an inactivated virus or it is a glycoprotein subunit which is going in the body and creating an immune response. So there is no possibility that against a lot of fear, there's a lot of fear about this in general public that I may get COVID through it. There is no way possible that anybody who gets a vaccine will get a COVID through it. It is not the COVID virus which is entering the body. They're just the antigens which are entering into the body to generate a protective immune response. So I think you must get it. Ranbir ji, tonu vaccine zarur lagwani chahiye.
Okay. Thank you, Dr. Thank you. Another question to Dr. Pankaj Soni. It's from Sonia Mahajan. Sonia, are you there? I would like to narrate a question. What advisory would you like to give regarding vaccination for senior citizen, asthmatic patients, pregnant and lactating mothers? Question to Dr. Pankaj Soni.
I think
already answer is being
Already answered.
done, like
Next,
very clearly. Let's talk
same
about
by
it.
Sonia is also here.
So
Hello, Sonia. You are not audible. Please unmute yourself.
Hello, everyone. Thanks for this opportunity. Most of it has been answered. My father is above 75. I'd like to ask about, is he eligible for a vaccination? Is it okay? And also for asthmatic, pregnant and lactating mothers, can they have this vaccination?
already, hi Sonia. Already we had, answered whatever you are asking. Definitely the age group is not important, but the pregnancy, the lactating mother, they should not get vaccinated. And the patients who are having current COVID, they should not get vaccinated. Rest everybody above the age of 15 to 18 years, they should get vaccinated, irrespective of any comorbid condition. Anyone who is having lot of allergic to lot of things, some people are allergic to so many antigens, so they should be under monitoring for say 1 or 2 hours after vaccination. Otherwise everyone should get vaccinated.
Another contraindication is if person is on blood thinners. So then you have to stop them before you get them vaccinated. So you have to stop them for a few days. So these are also as per the ICMR, Indian Health and Family Welfare Guidelines. You're not to take the vaccines if you are on those drugs.
Okay. Thank you for your valuable inputs.
Thank you.
Next question is from Mrs. Raminder Grover. If that has already been answered, I think. If I have already had COVID and recovered, do I still need a vaccine for COVID? It was very clearly told you need a vaccine immediately after 90 days. So because the antibodies will wane, and if you get a shot, the antibodies are going to multiply. Another question from Mr. Baltaj Singh. Is he there? Hi, Raminder. Please unmute yourself.
Yeah, I just want to ask if there is a risk of severe allergic reaction, and if I receive that vaccine, how do I report? And if I have a problem or a bad reaction after getting a COVID-19 vaccine?
Basically, nobody's going to send you home after giving the vaccine. They're going to keep you in the observation room for 30 minutes. That is a standard protocol.
There is a feedback form also which states any type of reaction that has to be noted, and that has to be
you are
sent.
vaccinated, you get a message on your phone and the link is there, and you
can share your feedbacks about reactions, allergy, any other major side effects if you are getting that.
Okay, thank you so much.
Thank you, Raminder. So next question was by Mr. Baltaj Singh. Is it safe for me to get a vaccine if I have an underlying medical condition? We already got an answer from Dr. Ravneet. Same question was from some unknown. He's asking if someone is suffering from any chronic problem like chronic renal disease, is it safe? The vaccine is safe as told by Dr. Ravneet. And now Miss Kritida Sajdeva has two questions about the side effects which had already been answered by Dr. Rana very well. And another was whether it is effective against SARS-CoV-2 strain. That is also been, Dr. Avneet, your inputs about that. Is it effective against the newer strains?
The vaccines are effective against the newer strains because the new strains, there has not happened so much of a mutation that will make the vaccine ineffective. So even if they are not 100% effective, they will at least decrease the severity of the disease. And as of now, if we talk about India, we don't have much of the newer strain prevalent in India. So we should not be much concerned about that.
But we are not doing the genotyping of the strains. So we are very sure we are not getting the patients of that strain in India.
For some of the who are traveled to India, they had done, and some of the centers which are virology centers, they are doing the research genotyping. And it's not possible to do the genotyping on the public center.
Yeah.
So the vaccine is effective against the mutant, the UK mutant, especially about the African mutant. It may not be effective, but what in India, the strain that we have is effective with it.
Okay. And the
And
last,
again, we said to decrease the severity of the disease. So we just keep on talking about some of the hypothetical questions to just increase the fear in the general public. So my message is very clear on that. Just do it.
okay, that's good.
Yeah, the take home message should be everybody should take the vaccine except
Irrespective.
the mentioned contraindications, and do not stop wearing masks, keep the social distancing on. We are happy that India is having decreasing number of cases,
Cases.
but let's not wait. Let's not allow it to have another spike.
And another addition, a lot of people are now considering after taking the first dose as if they are completely immune, but don't shed your guards. Unless and until you get a booster dose, you are not going to get a sufficient level, optimum level of antibodies. Till then, you need a protection. That is very important. A lot of people are shedding their guards. So the last question for the question answer session today was asked by an anonymous. What would our doctors commit on the fact that some countries are ruling that AstraZeneca vaccine is not to be used above 55 years? Are there any recommendations about AstraZeneca for age groups, Dr. Soni? Dr. Soni, please unmute yourself.
Yeah, I already quoted that the study which was done by Pfizer AstraZeneca was the age group was 15 to 55. There were around 75,000 patients they had taken, divided into placebo and a vaccine group, and there was no evidence that above 55 years like that vaccine is not safe. The point is very clear that they never said that this vaccine cannot be given to that age group. They said like the study was between 15 to 55 years. When we conduct any study, we have to have some inclusion criteria. So there was the inclusion criteria in that study. So now they are very clearly saying that like the Pfizer AstraZeneca Covishield vaccine is effective against UK strain and should be given to all age groups, and against the African strain there is some question mark, but we should not worry about that. Again, whatever my fellow panelists are saying, I totally agree with that, and very clearly conveying to everybody that we all should vaccinated as early as possible and whenever we get a chance, because like vaccination will give us the time to.
I think I have lost connection. So that was all about the question and answer session today. I hope the queries of audience are being answered very well by our COVID warriors of the city, and we are made aware about the importance of vaccine. I would like to call Himani Arora, our flow executive, to conduct vote of thanks.
Wow, what a fabulous informative session it was. We at Flow Amritsar wholeheartedly thank all our eminent doctors in abundance for throwing light on the much needed finer nuances of COVID disease and its treatment for all our valued members and viewers. I also wholeheartedly thank our members and all our viewers logged in today. Thank you for your support. And finally, I would like to take this opportunity to express my gratitude and appreciation for all our esteemed sponsors. I thank our platinum sponsors, Khurana Jewelry House, the pioneers in couture jewelry, is the most trusted destination for the finest jewelry. Their brand cherishes the importance of heritage, style, and innovation. Uddhav Realtech, they are the leading real estate developers creating the best construction marvels. Uddhav Realtech believes to continue its upward trajectory and runs with the motto of dreams made real. Coke, a beverage that turns up your day, providing refreshment in body and spirit. Gold sponsors Gitanjali Salon, The Couture by Khurana Jewelry House. Silver sponsors Divine Chocolate Factory, Moments by Kamal, Medicaid Hospital, Shaw Butters, and Golden City Digital Studio. Over to you, Meeta.
Thank you, Himani, and thank you, my esteemed panel of doctors. Thank you all. Thank you, Ruchika, for putting this all together. Really, this session, I think we can go on and on, but we are really running short on time, and doctors have given us a lot of time already. Thank you very much. And this session was really an eye opener. Many questions were answered, many queries. I myself had such. I sometimes go into that paranoia zone, but then listening to Dr. Ravneet and Dr. Soni and Dr. Rana, it really gives you that satisfaction and calms you down when you really need to know the right answers. So thank you very much once again, and I look forward to seeing you soon. Thank you.